Welcome to this session about inclusion in humanitarian action. This is a topic that has been overdue to be a main issue of conversation, so we are very happy to be given the main hall and for it to be prominent on the agenda of this Congress. A sad fact of humanitarian assistance is even when we have the best intentions, we aren't going to reach everyone. There is an implicit lack of resources and an implicit inability to access and deliver in the very nature of humanitarian assistance. The disruption in the physical and social status of the people we serve and in our inability to access and to deliver entirely for everybody is something we have to live with most of our days. The result of that has been historically, at least in some experiences, one of saying that we should be utilitarian, that we should be able to deliver as much good to as many people as possible. That isn't a bad idea, but it needs to be nuanced. Delivering as much good to as many people might end up with too little for everyone. And that is why we don't end up, for example, only delivering one cheap service to everybody in the world. Humanitarian assistance ranges from delivering cheap vaccines on mass scale to delivering fairly complicated surgeries to very complicated injuries, for example. Again, being able to deliver services means that we will start delivering them according to need. A needs-based approach assumes that we understand the needs, we understand the people, and we are able to line everybody in a community according to their need. And then we can go home saying, we've done everything we can for as many people as we can. This triage approach, this thinking that just our presence as humanitarian agencies or humanitarian assistance is good enough, that we've done our best, is hampered greatly in some occasions. And in my experience in working in some of the field projects, I've come across situations where that didn't work. And I'll give you a couple of examples before I move to the speakers. In sitting and trying to design a project for Yemen before the current war, and actually in anticipation of it, we had to sit and decide what is it that we should do in the interim, what would be the best thing to do and what would be the best thing to have when violence breaks out. And we ended up doing the regular, an emergency room with surgery that ended up serving a lot of people who are injured. What we haven't seen and what was predictable and could have been anticipated is that in the communities around us, there were young girls who've been married off and who had no health services, that have been through marriage at a very young age and have been made pregnant and have given births with very absolutely minimal services. And we should have seen that. And that doesn't fall within they aren't the group we are helping. In South Sudan, a couple of years after that incident, there has been a mass exodus across the border from North Sudan to South Sudan. What we found out that should have been anticipated is that families that had to walk for many hours and many kilometers ended up having to choose, do we carry up on our shoulders the children or the elderly? And our colleagues have found elderly people left on the side of the road because they weren't possible to carry on. And examples go on and on. One of them is in Congo when we found people who have mental illness tied to a tree so they wouldn't harm themselves or others. And those aren't similar, but aren't exactly the same. The difference is from a medical humanitarian organization, it was easy to see mental illness as a disease that we have to tackle and treat. So we went on a massive effort to prepare our physicians to treat mental illness, and that happens much more frequently. The problem is when we do not look that our inability to reach people excludes whole groups, not because they have a certain sickness we can treat, but because they have a characteristic. Those have traditionally been groups that are either by age, older people, or by gender, usually women and girls, or by disability, those who we do not see because they cannot access us. And this doesn't allow us the luxury to say that we've done what we can. It doesn't allow us the luxury to say that this is as far as we can with the resources we have. A complete exclusion of whole groups isn't anymore something we should be able to live with. To discuss this today, I have an incredible panel. So I will be proudly introducing my colleagues here. And the first one is Henry. And Henry Legge comes from South Sudan and has studied for part of his life in a special school that addressed the issue of his visual impairment. But as of the age of 13, he studied in normal schools. He graduated, he had his education continued both in Juba and in the UK, and is part of the South Sudan Institute for the Visually Impaired today and works on humanitarian assistance. Thank you for being here, Henry. The next person is, thank you. The next panelist is Ulrike Last, who works in Handicap International, and who I would credit with the presence of this, because she was one of the people who had angrily showed me how wrong I was in arguing against this once in a previous Congress, and one of the few times I was convinced of something I wasn't convinced in such a short session. And we discussed having this session, so thank you for that, Ulrike, and thanks for being here today. The last panelist is Ghida Anani, who comes from Beirut, and in the nick of time, I must say. Thank you for coming, and she runs, she has quite an impressive CV, but most recently she runs an organization called Abad, or Dimensions, and it is an organization that works on gender and empowering women, and she has worked and helped survivors of sexual violence. Thank you all for being here. I will also thank Joanna. I will thank Joanna for being our interpreter. Thank you very much. And I will hand the microphone to
Thank you very much, Dr. Tammam. I'd like to say good afternoon to everybody who's here. In the next 7 minutes, I'm going to highlight some of the issues that face people with disabilities in humanitarian action, and suggest some actions that I believe that we in the disability movement in South Sudan and other places believe that will change the situation. So if I just give a bit more of the context in South Sudan. So I was born and grew up in South Sudan, like he mentioned. So yes, the bombardments and everything, that's all. Since from the time I was a kid, we even used to imitate the sounds of artillery and things like that. So I come from that kind of background, and I remember times when we would have to move from Juba to my hometown or my home village where I was born to seek safety. And when I was 4 or 5 years old, my mother would carry me on her back, and so to walk about 7 miles from Juba. Yeah, so the 2013-2016 crisis all both found me in Juba, and yeah, but thankfully I'm here today to share with you some of our experiences. Now, when we talk about disability, of course, I know that what comes to our mind easily is somebody losing one part of the body or the other, but that is what we call impairment. So from a social point of view, or from the social model of disability, we understand disability to be the barriers that are both environmental and attitudinal that exist in our societies that affect the way in which we relate with persons with disabilities on the one hand, but also it affects the way services are delivered to meet their needs. Now, I will talk briefly about factors that we have found to be leading to the exclusion of people with disabilities. And the first one I would like to point out is the labeling of persons with disabilities by actors, including governments and NGOs, as people who are special. So I've been to several places where if somebody talked about disability, they would say, oh yes, these are people with special needs. If you read the Constitution of South Sudan, it says, it refers to persons with disabilities as people with special needs. And I have been argued against that, and a few others, we've been arguing against that statement, because to say that somebody is special is to bring an excuse that because they are special, not everybody can handle their issues. So they need to go to people who are specialized. And I think that is wrong, because persons with disabilities are not special. Of course, they are just like everyone else. They may have specific needs, I would call that. I wouldn't call it special needs. They might have some specific needs. Just like I need a screen reader to use a computer, but I use the same computer that everybody else in the room uses, so there is no special computer for me because I have visual impairment. So if you see what I mean, because that affects also the way in which people relate to persons with disabilities. And so that is one thing that I think needs to change for us to address disability and for us to respond effectively and appropriately to the needs of everyone, including those with disabilities. We just need to understand that persons with disabilities are just like us, so they are men and women, boys and girls. Yes, they can be in a position of poverty, but at the same time, they can be in a position of riches and wealth, depending on the circumstance. The second point that I find important for us to highlight is the assumption that everyone who has an impairment is necessarily a beneficiary, especially when we talk about humanitarian action. And they are vulnerable. Again, I was in a workshop where when we talked about disability, somebody said, oh yes, let us put them, let's just call them a vulnerable group. And I was like, no, sir, that is wrong, because if you just say vulnerable, and because you are going to talk about other persons also who are vulnerable, you are likely not to address the issue sufficiently. And he said, okay, so how do we put this? I said, no, they are persons with disabilities. They can be vulnerable, but also they can be not vulnerable, depending on where they are. And so, again, I happened to be at a workshop where people were giving an example. It was a workshop that was organized by a UN agency. I won't mention that name of a UN agency, but, well, it was a great workshop. But here's what I want to tell you. The facilitator was giving an example, and she showed the participants, all of us, a picture of a beggar who was said to be blind, and the person was said to say, this is a beautiful day, but I am blind and I can't see it. And I was like, yes, this could be true, but it can also, I disagreed with that a little bit, because I said, okay, how do you define a beautiful day? Because, I mean, for me, a beautiful day wouldn't require an eyesight. You don't have to have eyesight to know whether a day is beautiful or not. I mean, if you are healthy, if you are happy, I would call that a beautiful day. So I think, yes, our understanding of disability matters a lot. The third factor that I wanted to highlight, which leads to exclusion of persons with disabilities, is that in humanitarian action, in most cases, people with disabilities are largely absent. From the research, from the studies that are done, the various assessments, if we take 10 assessments and if we wanted to find out which of those 10 addresses disability, if that was done in South Sudan, I can guarantee you that you may or may not find a single assessment talking about disability. Of course, in the recent past, things have started to change, and I think thanks to organizations like Humanity and Inclusion, ICRC and others, who are doing their best. But I think the case that we are making here today is that because disability is not special, remember the second point I just mentioned, So it means that everybody else needs to get on board. The participation, so what are we doing as organizations of people with disabilities? One thing is that I think it is very important for us to have that collaboration between international and national organizations, and especially organizations of persons with disabilities, because they play a great role, and we have done several initiatives in South Sudan where we understood that working together we can achieve a lot in the field of disability. One example I would give you was the development of a national disability and inclusion policy in South Sudan, which was supported by a number of agencies, including Humanitarian Inclusion and ICRC. But I would like to point out that persons with disabilities were at the center of the whole process, so they participated effectively. Their views were taken on board. I mean, unfortunately, because of the crisis and everything else, that policy hasn't yet been implemented, but I would say the development of it was quite inclusive. And I don't actually have to give examples from far. I think the fact that we are having this session now interpreted, we are having it interpreted by a sign language interpreter, is a good example of inclusion. The other thing that I think persons with disabilities also are capable of doing and may need some support to do more is providing peer support. Much as of course it is important for us to do psychosocial support and everything else, but I think that if one person who has an impairment listens to another person with an impairment who has positive experiences, that is likely to change their lives very significantly. I happened to be giving a presentation at an IDP camp in Juba in 2014, and one of the people listening to my presentation happened to be a blind woman who came from, I think, Bentiu. And after I finished, she said, before the war, she used to work in the farm, but some people in the community said to her, no, because you're blind, you don't have to do the farming, I mean, somebody can help you. And so she was convinced and she stopped doing what she had been doing. But when she listened to me and she said, okay, if that blind guy is telling us that he has been doing 1, 2, 3, when peace comes, I'm going to go back to the farm and I'm going to continue doing what I was doing before. Because when I was told that I couldn't continue to do it, I thought, well, because of my visual impairment, I couldn't have continued. Now, I know that time is running out, but I just wanted to remind all of us that it is our obligation, that there is no excuse, of course, to exclude anyone. But I understand that one of the challenges of humanitarian actors is also that they sometimes lack the knowledge, sometimes they don't know. So the commitment may be there, but how to do it may be the problem, but that's why we are there, organizations that are national, we are there, and we can work together to make sure that we achieve genuine inclusion. Thank you.
Thank you very much, Henry. Thank you. I'll move to Ulrike.
Thank you for giving us the floors. Thank you for being here. I've been listening very attentively today to the first 2 panels, which discussed at length dignity, and I thought, this is great. Our panel is going to provide another confusing and maybe also self-reflective vision on what means dignity for persons with disabilities in accessing and also participating in humanitarian response. And to offer a different angle of perception. And I'm going to do that by sharing with you some of the key barriers we have been observing, which are faced by persons with disabilities and also other groups at risk of vulnerability. And as Henry said, there is no such thing as the vulnerable groups. Persons with disabilities are not the one which are vulnerable, and neither are women, as Ghida will share with us later. So what are the 3 major types of barriers which we found really useful to identify in humanitarian crisis situations in order to overcome them? So I don't want to highlight only problems, I want to highlight the problems which we can solve together, as Henry said. So first of all, it's institutional barriers. And they are the most difficult ones, or we could argue the easiest ones to overcome, because they are the barriers which we as humanitarian actors create. So it's the policies we have inside our own organizations which may not mention persons with disabilities as staff in our organizations, which may not have persons with disabilities in the needs assessment formats we are using and in the guidance. It may be the humanitarian standards our sector likes to follow. The standards often don't refer sufficiently to persons with disabilities, but also other groups at risk. And if they still refer often to them as special needs groups or as the vulnerable people in one box. Another part is also the coordination mechanism. Very often these days we will find somebody who is a focal person on gender, and not only to look at women, but on gender, to highlight if data is missing, if other aspects on the situation of women or men, for that matter, are not considered in our response. But we don't have that yet for disability. In May, I was participating in a consultation in Addis Ababa on inclusive humanitarian action, and a deaf woman, by coincidence also from South Sudan, she asked all the humanitarian actors present, who is accountable for our inclusion? Who is really following up in the humanitarian response that persons with disabilities are not left behind? Tammam already alerted, and we all, if we have been in the field, know that sometimes people with disabilities are left behind. And there is no accountability mechanism yet. Even if we talk about affected populations, persons with disabilities may be mentioned as the last group, if at all. And what is not mentioned is not included in our programming. And that is the other key part I wanted to share with you. If we don't collect data and if we don't identify persons with disabilities in the projects and in the programs we are working, we don't know whether we include them. By chance, if we are in the field, we see many actors do engage women, they do engage persons with disabilities, but they don't engage all, and they don't engage them necessarily in the way these people want. So that is the other part. If we don't know, if we don't identify them, if we don't count them in our beneficiary number, and if we don't engage them as humanitarian actors, we will not be likely to have an inclusive response. And that is the second part on the institutional barriers, is that there's a lack of participation of affected population, as Henry said. If they are not asked to be involved in policy making, the policies will not be inclusive. And we have been hearing great, by Christina Bennett from ODI about the research on dignity, and one of the questions I hope I will be able to ask her in the course of the days is, was there a disaggregation in that research when we talk about the Syrian and also the Rohingya refugees affected by the crisis? What about the dignity of groups within those groups they've been interviewing? What did people with disabilities say? What did women say about, was there a difference about how they define dignity versus men? Was there anything more than the box of the Rohingyas and the Syrian refugees? The other barriers, I don't want to go more in depth. Henry already mentioned them. They relate to barrier, to labeling. They relate to stigma and discrimination, which often happens at the family level, at the community level, but also at the level of our humanitarian colleagues. And it's about the misperception of the capacity of persons with disabilities, but also other groups at risk. And it is also about our own misperception about what we can do as actors. Handicap International recently changed to Humanity and Inclusion, our name, on the international level. But it's not very rare that in a refugee camp, people say, if they see a person with disability, go to handicap. Even if that person needs a shelter, if the person needs education, they're referred to us. And the reason which is cited why people send them to us, they think disability is too complicated. We can't do disability. We are not a specialized actor. And that is the other one. The second big misperception is about the easiness and also the creativity inclusive humanitarian response can bring to the humanitarian response. The last type of barriers, before I will conclude, are the environmental barriers, which are the most obvious barriers. Those are the barriers if we have a health center, but we don't have an outreach service. People will not be able to access the service. People who have difficulties moving, people who have difficulties to be accompanied, who don't have somebody to accompany them, will not get to the service. We have also inaccessible shelters and wash facilities which do not allow dignified access to persons with disabilities. The same, what we've observed in the field, goes for counseling places, goes for education and schools. And the last, and Henry alerted to that also, is communication barriers. If we don't have sign language interpretation, if we don't use different channels to reach the people we want to communicate with, who have different ways of communicating than us, we will miss them. We will miss to inform them about where they can access service and what are their rights and entitlements. And so, this is all I would like to highlight from my end, sticking to the 7 minutes I had. Thank you very much.
Thank you very much, Ulrike. Finally, I'll ask Ghida to. Thank you.
Thank you. Good afternoon, everybody. Thank you, Dr. Tammam, and the organizers to allow us the space as Lebanon to be part of this important Congress. Well, I will have to take you a little bit to another part of the world, which is the Middle East. And what does it mean running inclusive programming and humanitarian response in a country like Lebanon with its neighborhood? Well, to start with, I have to say, I don't know how we're working the inclusion while we don't know the size of the population of Lebanon. So we don't know how many people are there, and we don't know the characteristic of the population in a very accurate way. When we design such programming, apologies for this, we go even beyond the specific international known definition of inclusion, because inclusion in Lebanon does not only mean that all people concerns in sense of gender, age, and special needs, but it means a little bit much more in sense. First, which religious group and the confessional breakdown. So if we're designing a program, we have to take into account that we're inclusive for all groups under different confessions. I know that, I don't know how much you are aware that in Lebanon we have 19 confessions and we have 19 laws regulating family issues. So when we're talking about gender-based violence, we're not talking about one standard. We're talking about tailoring everything to make sure that any person, woman or man affected by gender-based violence can access information and protective services. To do that, we have to take all these layers into account. First, the layer of religiosity. Second, sadly, in our reality as well, we have to take the legal aspect, in sense, having papers, birth registered or not, marriage registered or not, because everything can affect the accessibility to the protection service. If we're talking about various nationalities as well, we're always faced by registered with UNHCR or non-registered with UNHCR. These are all elements in our reality as local NGOs and activists that we take into account as invisible barriers that hamper full inclusion or full accessibility to all. If this is set as a criteria that, okay, it's these services or these funds only go for people from Syria but registered, then you can use the resources to serve. If they're not registered, this is not an option to use the fund or resources, even if it's life-saving situation, even if it's gender-based violence. So the legal status is one of the aspects that we look into, especially in cases, in very delicate cases, like unwanted pregnancy. You know, abortion is not legal in the country. And anything related even to hymen construction or after rape is also illegal in the country. So working in such programmings, while there's many layers in the law that are already prohibiting such kind of interventions, these are things that also put us under challenge on how to do it. So if a woman or a woman with a special needs, but also survivor of sexual assault, having HIV/AIDS, pregnant, is coming to seek support, what is the angle that you need to use while working within the system? And the fourth layer related as well to the invisible barriers to inclusion is also the political affiliations. So there's also requirements when it comes to serving the people even under GBV programming. In this area that is pro a specific political party, or that area that is more even in the humanitarian response. This is one of the layers that we have to face every day. Even with people that are fleeing from Syria due to the entire crisis over there, if they're pro-regime, against the regime, it makes a difference, even under gender-based violence programming. So just to give you, this is a few examples of the reality that we're having to strategize and do the planning around in our daily practice. Nevertheless, just to also use the second part of my time to share with you practically how we're doing it then, if this is the reality. As Abad, we're a resource center for gender equality that has been established in 2011. For us, inclusion as a philosophy and as a principle was core in even the designing of the organization. In sense, in our internal policies, because you have highlighted that, we're inclusive in sense, men, women, part of the staff, of the decision-making, of the advisory board, but also maternity leave, paternity leave, everything related to also having the people under the, as part of the team with the special needs or a certain type of impairment. We have like 10 to 15% every year recruitment where we take into account people with special needs, but also the age. In sense, because of the retirement age in the country, which is 62, with zero benefit, social support or social security after that. So also the people that are 62 plus, even very expert in our field, find themselves like really in situations of high vulnerability for no reason. So even in the team composition and the expert and the advisors, we have staff varying between 18 and we have actually 75 as organization in sense of the age group. And this is all reflected in the program that in what we serve, what we provide, what we offer. So the composition in very brief of the operational mode of Abad is having the inclusion and the various service in all its elements that I just listed before. In sense, we're managing 3 safe shelters, emergency safe houses for women and girls affected by gender-based violence, regardless of any layer of any condition. The only condition to access these shelters is to be at high risk or survivor of GBV, regardless of age, papers, type of gender-based violence, who committed that, what is the affiliation, nationality, religiosity, confessionalism, special needs, and the list can really be very long. In parallel to that, we operate 13 women and girls safe spaces across the country, reaching the border. And all these are accessible to women and girls in communities, regardless as well of profile, but also they are equipped in a way where anyone can come and benefit from the various activity, and supported by shuttles for those that are living a little bit far from the area to be able to access the service. We complemented that philosophy in having men centers. So we're managing 3 men centers across the country that provide, from one side, rehabilitation services for men with abusive behaviors, because for us, even the so-called perpetrator should be included in the planning if we're using a public health approach and a systemic approach, which are the guiding methodology of the work of Abad. So excluding men that commit the violence or commit the abuse is in itself a violation of the principle of inclusion. Because if we want to work on prevention and we want to ensure that we all achieve our objective in reducing gender-based violence. Lastly, to complement the schema, because we're aware that we're not able to reach everybody, elderly women affected by gender-based violence will not come to the centers and will not come to awareness sessions. Women survivors of GBV with mental health challenges or physical challenges will not be coming also to the centers. So we created a model of mobile bus that is inclusive as well in sense of accessibility and the team specialization and the different units inside the bus and the population targeted to go and tour every week, stay 3 to 4 days in every single village, touring the country during the 12 months of the year. And now we're adding to it a component where also the art-based activities are provided as well for people with any kind of impairment in sense of like vision or hearing impairment to also benefit from that. This is in a very nutshell. Thank you.
Thank you very much. Thanks. We will have a few questions on the panel, and then I will very soon open it for discussion with the audience. But please, if you feel the urge to ask questions, let me see your hands, and I'll start with something. There are several distinctions that come up, and I'll just list them to start with. One distinction is between treating the disability as separate and treating, mainstreaming everything that happens to a person with disability. And this is quite an interesting distinction because it's not only that people are told to go to handicap. We often say call handicap when there is an issue of disability. The difficulty of seeing people who have disabilities as regular people requiring regular services. The other one is, Ghida, you mentioned the work you've done on making your organization inclusive to people who work in it, not only to people it serves. Yeah. And that is an interesting notion because it feeds into the one that started this morning about inclusiveness of the humanitarian sector, the inclusiveness across national lines, across backgrounds and so on, and you're adding a dimension of, and I'll start with a question to you. Do you think that we can actually behave in an appropriate and considerate way that addresses people, whether on issues on gender or issues on disability, if we do not include that in our organizations themselves? Yes, please.
I would say this is a core value and principle in sense of integrity. Because if we are going out and providing services for people and we're saying, and we work on gender issues and not only the image, the programs, the staff, the policies, the services, are not tailored for both men and women, then we're not gender organization, not gender-based organization. I wouldn't say it is easy, because it was quite challenging since we started how to ensure the integrity even beyond the gender breakdown and the age breakdown and the inclusiveness and sense of special needs, but also in the leadership, in the management. If we're working on promoting gender equality and also like non-violence, it's not quite easy to do that on a daily basis, even in the operation and the commitment to the contracts, to objectives, and dealing with conflict resolutions that can happen within the organization, and believing in saying that it needs to be fair and it needs to be justice is key. It's not quite easy. Even the paternity leave thing and the PMS thing, like, you know, for women and for men in the organization, respecting all this, it's a way of living, really. I have to say as well, in the accountability, when you were talking about accountability systems in such organizations, this is where it adds a layer of complexity, because how you ensure that the complaint mechanism is accessible by everybody, especially if I'm an organization working on ending sexual gender-based violence and there's a sexual assault, and I think we're going to talk about this a little bit tomorrow in another panel, but like for us it was like, okay, the most vulnerable or the most people that can be really affected by sexual assault are people with special needs. So how you do PSEA and the complaint mechanism and the investigation.
Can you explain PSEA? Can you just...
The policy on sexual exploitation and abuse. So how to make all these safeguarding policies in sense that are inside the organization, known and used by everybody, and at the same time to the people, the right holders that we're serving. It's not easy.
Thank you. And Ulrike, if we were not to go and call handicap for every time we see a person who has a disability, do we have the tools? Are there, what, do we know what to do, and what do we need to do it better?
So A is already like the first answer to your first question. It's really walking the talk. Even as Handicap International, we continue, or now Humanity and Inclusion, we are still learning to be inclusive ourselves. Our expertise was on people with physical disabilities. We are still learning on people with hearing difficulties. We are learning to employ people with intellectual disabilities, people with mental health problems ourselves. So I think it's really important to have that notion, and we have to plan for that. If we don't plan for blind colleagues to have a budget so that they can have a screen reader software or a personal assistant, or to have sign language interpretation, we will involuntarily discriminate. Okay, so we really have to make sure that our budgeting and our human resource policies are really inclusive, and we have the means to be inclusive. And that leads me to the second part, what we do internally, and that is really where most of my work is internal advocacy. And we support other actors not to do external advocacy, because how can we be an example on inclusion if we are not fully inclusive ourselves? And this is really where we have developed a lot of tools and also processes. As Henry said previously, we do develop barrier and facilitator assessment tools which help other actors to know where are the gaps. And it's not us showing you where is your gaps, but it's us doing it in a participatory way for you to explore what are parts, where are you already good, what can you strengthen. If you're already good on gender, it's easy for you to also add the next layer, as Ghida was mentioning, of disability, to become more inclusive in that. And so we do have these tools. We also have capacity development tools. What we need to do is really to systematically share them and to have better data, which is really something where we also have tools developed on how to identify persons with disabilities, tested in emergency with 6 very simple questions. Because very often we are asked, how do we find them? They're hidden in the homes. We don't know how to see them. And yes, some disabilities are not visible. So we did test tools which take 1.5 minutes to administer in any beneficiary collection, which will tell you in how far you are inclusive in your response. So we do have tools on data collection, we can support, and organizations of persons with disabilities can support you to have more inclusive policies. There's no excuse, as Henry said.
Thank you. And Henry, when I was a kid, I passed almost every day besides the school that said, in Damascus, that said, school for the deaf. And it was, like most of our schools, looked like a prison, had high walls, and we never saw anyone come in or out. We were told this is a way to enable people to, address their needs. Obviously, that's not the case. How can we not do silly stuff, like build a school that excludes people instead of include them? And I know the answer in part is ask those people. I hope that we have, in the humanitarian world, arrived at a stage where we actually know, at least in principle, we have to ask people we're trying to help. But if we are sitting in places where we're planning, what is it that we should think of so we wouldn't do silly stuff that ends up being more harmful than useful? Yes.
Yeah, thank you very much. I think that's an interesting question because I remember a couple of months ago chatting with a Kenyan guy who told me that until recently, very recently, Kenyans, blind people in Kenya were only allowed to study law or education for your bachelor. But I told him, well, in South Sudan, I did communication. I studied journalism. So, and I was like, oh, so that means even South Sudan, despite the challenges we've had, I think we are a bit better, because if I was a Kenyan then, I think at the time I wouldn't have gone to the School of Journalism. So basically this goes back to the assumptions that somebody needs something and not the other, because, okay, what you're saying, it makes sense, of course, for you to say, yes, we are building this facility, we are setting up this resource center to train somebody how to use Braille, to train somebody how to use the white cane, for example, or sign language for the deaf, etc. But then that only needs to be something that gets them started. Because if I went to a special school all the way to, because I only did it for half of my primary, and I'm really proud, I'm really glad, I'm grateful that I didn't spend much more time than that, because that would have affected even the way I interact with others, because I think there's a lot to do with socialization when you are with everybody else. Because I remember when we were taken to a mainstream school, of course there were kids who said, well, are they going to learn with us? How are they going to do it? But eventually, I remember even becoming the first in the class when I was in primary 7, and they were like, oh, well, people are the same. So my answer to you would be, yes, do consultations, but I think it's also very important actually to invest even research. So if the Ministry of Education is thinking about dropouts, I continue to hear, and of course I would like to continue hearing that there is a lot of money going to girls' education. I mean, I'm not jealous of that. That's fantastic. But I rarely hear about any donor or any big organization investing on people with disabilities, on inclusive education. Because nowadays we don't encourage special needs education anymore, and that's the reason why I definitely disagree with the notion of special needs, because it tends to put people with disabilities in a special position. So yes, we need inclusive education system. You can still have the specialized assistive technologies and everything else, but let them be in a mainstream school. Let them have a future like everyone else. Yes.
Thank you very much. Thank you. I'll open the floor. Do we have any questions or comments or statements? Tirana, please. Sorry, we have a microphone already there, so please go ahead.
Yeah, sorry. I was wondering if you could maybe talk about some strategies that are used for dealing with types of inclusion that might have an intersection with social norms challenging cultural norms. So I'm thinking specifically about things like LGBTI+, but also about things like widows in the community and the way that widows often suffer from certain types of discrimination, or albinism, for example, where there are specific protection issues. And how do you challenge some of those challenging situations where there's an intersection?
Could you introduce yourself, please?
Sorry, my name is Clea Khan. I do humanitarian consulting work.
Do you want to answer it? You can answer. So, yes, and it's something under the institutional barriers I did not mention. Yes, there are strategies, but also one of the key challenges we found, it's what is alerting to you. We don't really monitor systematically disability-specific protection risks or risks which are other than women or children. So it is considered normal. The attitude in many cultures we work in, it's considered normal to chain people, or with mental health issues, and people say it's for their protection. And we do have to challenge those things. What we often do in our work is to work together with refugees with disabilities, if we work in a refugee context, because they know their community. So we support them to identify what are the ways to challenge those notions. Are they only about the culture? Are there other aspects behind it to really get to the root cause of why these violations and rights abuses are taking place, in order to find solutions for them? And there is not one strategy. I would say you nearly would need in every community or culture the specific strategy. Sometimes we already have functioning court systems. We can challenge the existing laws to become more inclusive of some of these violations. Sometimes we need to work through the community-based structures and traditional leadership, and that's really difficult for us to do. So we really work with our local partners in order to address those issues. So this is a key part of our strategy, but maybe Ghida would also want to.
I will actually add to that what worked with us in Lebanon in sense of strategy, especially on topics that are quite sensitive, as you mentioned, like LGBT, or the issue of early marriage being legalized by the law. We always try to, we took the entry point thematically to communities, like the broader frame of sexuality and SRHR, the sexual reproductive health and rights, to start the trust building with communities on health related issues, puberty, stage of development, and then to reach the point about talking about the body and how to protect the body in sense of hygiene, nutrition, and then from unwanted touches, and from there go to unwanted pregnancy. Why? Because of early marriage, and then go from there. When we built the trust in communities that in the forefront we're not coming and addressing the topic, this is the title, then it worked. For issues of gender and sexual identities, we try to make it inclusive in the service in the way of accessibility to the service. So when it comes to clinical management of rape, for instance, the trained facilities that are providing the PEP services, the training even for the personnel was provided in sense, regardless of the survivor gender or sexual identity. These are the steps to do it. So from the medical perspective, I have to say this is still one of the topics that is not easily addressed, especially with the security officers that are very much discriminating against members of the LGBT community. But at least now they are trained on clinical management of rape as police. We're able to open that debate, but always as a key tactic, if you want, not a strategy, as a tactic, was start with the soft topics that are, it's a common denominator, and then take it from there into topics that are more delicate.
Thank you. We had a question with Tirana, please, here, microphone.
Hi, Tarana Hassan from Amnesty International. Thank you, first of all. It's really wonderful to be in a forum like this and to have inclusion so prominently being discussed. It's really meaningful to many of us, so thank you. So I have a bunch of questions, and since I have the microphone, you can't stop me. First of all, Henry, I really hear your point around we need to consult with local actors, and from where I'm coming from, it's about responding in times of crisis and conflict, you know, and looking at rights violations. And one of the concerns that I have, and I think it's something we're planning to do a lot more of, but I must say that I'm very nervous in operating in this space because we don't have expertise. And my instinct is, yes, to consult with local actors, but will we be more of a hindrance? Do we start pulling on resources if everybody is going to local organisations? So I guess I'm asking for guidance in a way on how we do it in a way that is not a drain and a burden, that is respectful and serves everybody. And secondly, this is for the whole panel, quite often when we've been pitching the idea of having specific roles for looking at people with disabilities in emergencies or in crisis, or the elderly, and I'm told we need to mainstream these things. I have a really violent reaction to mainstreaming, but I'm wondering if that's just me, and would like to hear your perspectives on this idea of mainstreaming. And last one is around resourcing. So we talk a lot, and actually I think you touched on it, Ulrike, with the idea about budgeting and just looking at hiring this post and thinking actually you have to hire 2 posts. Thinking about publications of reports and thinking how do you do accessible reports? Is our website ready? And all of these sort of things. I'm really curious in the humanitarian space, how much funding is available in the first phases of an emergency to include disability or any sort of inclusion programming for life-saving assistance?
Thank you. I'll start with Henry on the first question.
Okay. Yeah, so the first question on rights violation and how to go about that as international organizations. Yeah, I mean, I would say, because it's important that we, of course, we address all issues of violations. So whether it happens to a woman, a man, or someone with a disability, I think it of course, it's important that we address it. So, for example, I think Amnesty International actually published a report on the crisis in South Sudan, and there were some specific issues about people with disabilities being caught up in the violence and about the violations and everything else that that occurred to them. So I think, yeah, it's something that is, I would say, yeah, just like it is done for every other group, because of course they have all the rights and they shouldn't be denied access or everything. But yes, if there are issues of communication, I think that's where consultation is important. If, for example, you want to maybe interview some people with disabilities who may need some assistance, I think, yeah, that's where it would be great if you could get in touch with local organizations around, just if that's needed. But if you could also have your own way of doing that, I think, yeah, I would say it's something that wouldn't cause any hindrance. That would be a great thing to do, because of course rights of people with disabilities must also be protected on an equal basis with the rights of others. Yeah, thank you.
Thank you. I'll allow myself to give a comment on the issue of mainstreaming, because it's interesting. I think we have a lot of coded words and expressions in the humanitarian development sector. Mainstreaming could be making things easier to do, and could be saving money, and could be ignoring stuff. In essence, my theory is we are, in the humanitarian sector specifically, hung up on things that we can treat and make disappear. So, in MSF, for example, we have taken it on ourselves to treat tuberculosis and to treat tuberculosis in horizontal programs. And at the same time, we have failed repeatedly at dealing with palliative care. We theoretically can make tuberculosis go away, and we can't prevent people from dying from any from any other reason. We have a need to treat people, to make them not die, to make them survive, which is practically the essence of what we are trying to do. But it risks ignoring things that we cannot averse. And old age and impairment and pain and poverty and exclusion and discrimination are things we cannot necessarily averse through humanitarian aid, so it's easy to not do them. I don't think we always need to mainstream, because when we treat tuberculosis, we create tuberculosis-specific programs that have specific purposes at a sometimes extremely high cost. I wish we'd do the same for things that we cannot treat but that are necessary to address. So we sometimes have a place that would pay thousands of dollars on surgery but have no ramp to get a wheelchair to get inside the hospital. This doesn't mean that we have to create specific programs everywhere, but it has to be possible. It has to be something we are able to address in the same way that we address some of the diseases that we have put so much effort on. And this goes to the resources as well. We do spend extensive amount of money. The problem is that we still, I feel, address disability as a discrimination disability or in impairment as a negative right. Just don't discriminate. And no one thinks about all the resources needed to make it possible to level the playing field to start with. We are happy to celebrate people who survive and to ignore people who we don't see. So you look at TV and half of the channels celebrated the single girl on a wheelchair who crossed the Mediterranean and managed to arrive to Europe. And zero of them, and of us, asked how many like her couldn't even think about the issue. It is important for us to take a conscientious decision that we cannot continue to exclude people who are our responsibility. And I say our responsibility consciously, because when MSF or a large organization says we are providing care to this population, we're not only providing what we choose, we're deterring others from coming and being part of the care. There are places where we have been the primary care provider for decades. So I think it's a decision as well as one of resources and mainstreaming.
Yeah, I think, my take on the issue of mainstreaming would be, I think, because if we, I know the issue of resources, so mainstreaming to me would be like if you are, for example, if you are UNICEF, let me say, and you are working for children, for all children, I would say children with disabilities, of course, are part and parcel of the children that you are working with. And of course, that would mean you also need to make sure that whatever service you are delivering also benefits them equally. Because if we choose the specialized approach, which is currently the norm in many ways, it's going to be very, very difficult to address issues of people with disabilities. So for example, in South Sudan, I remember a study that was done between Humanitarian Inclusion, that was formerly Handicap International, and IOM, the International Organization for Migration. Now, IOM, of course, is one of these mainstream organizations, but they realized that they couldn't be able to address some of those issues because they didn't have the expertise, for example. And so I think that was why HI, maybe Ulrike will mention that, but because I also happened to be one of the consultants that was hired for that survey, so I remember quite well, and I know how important that survey was, because there were several issues that were identified. And I think now IOM is interested in going forward, and they requested training for their staff, and I think they are going to work on their complaint mechanism to make it more accessible to people with various impairments. So, yeah, I mean, if you were to ask whether we should choose a mainstreaming or a specialized approach, I would say the specialized approach should only be a small part, but I think the goal should be to mainstream. Thank you.
I would agree, and it's good how Tammam started. It's like it's important to know for what purpose. If we mainstream in order to save money, that's not going to work. We're just going to tick boxes, and we know from gender it doesn't work. It doesn't work to do 2 days training on gender, even if it's the best trainer, if we then don't change the way how we work, and if we don't change the DNA of our organization. So mainstreaming for us really means that persons with disabilities and other groups have the same access and enjoy a dignified access in the same way as we do, and based on their choice. And so it means that we, from our perspective, that we have to mainstream to remove the barriers we pose, okay? And at the same time, we need to be very clear that some specific services, as Tammam alerted, tuberculosis for many people, but not all people with disabilities, need specific health-related rehabilitation services. So I hope in the future, HI will still be an expert in providing these specific services to those people who need it, people with injuries, people with long-term impairments, but that should be, in that sense, mainstreamed as part of the essential services without losing the specificity. And also what Henry said before, the other important thing is people with disabilities, as well as some of the women, have been impacted also, which makes them more vulnerable in humanitarian crisis before, through discrimination. So if we don't empower them to work on the same level playing field with us, if we just mainstream without looking at those people which were already left behind and in times of crisis die, that is something where we really need to be able to have specific outreach action to make sure that these people catch up and are equally protected. Thank you.
Yeah. I wanted to comment first on the first point related to the localization, because this is a little bit for us sometimes provoking in sense, because the perception toward localization is not about that what is now being promoted as if like local NGO should take the place of INGO. It's not a war that is starting between INGO and local NGO. In contrary, in sense, it's not about droning the local NGO with the resources because everybody should go to them. It's actually about stop wasting resources and creating parallel systems in sense, working together. If we're very genuine about what kind of change we would like to see, is really to be genuine, to walk together toward achieving that change. If it's about, and apologies for the term, but in my side of the world, even a humanitarian response became a kind of industry. And this is something we're seeing, and it's about not doing what we have to do for the sake of continuing what we're doing, okay, which is in sense contradictory to the concept of integrity. On the second aspect of mainstream, again, it's a question for me, mainstreaming or doing the thing the way aligned with the value, it's equal to the concept of integrity. It's not about like as Dr. Tammam was mentioning, in sense trying to create special things to accommodate everything. It's a way of living. It's a lens that is from where we do everything we do, simply. And my personal theory is about the moment where, even as people committed to work on promoting human rights, we started dividing the principles under the Human Rights Convention, this is where we started to do the harm. Because from there, and the guiding principles of the convention, we all know that are undividable, supposedly. Then we created, like, you know, a convention for women, the convention for people with disability, for refugees, for migrants. And this is from where we complicated our lives, and we need to be brave enough after these tens of years of working to question ourselves about our approaches. In our field as feminists and promoting and working on gender-based violence, since 1992 in Lebanon till 2018, we cannot pretend that we were able to reduce by 0.01% gender-based violence. And I think it's about the time to be sufficiently okay to start that journey toward ourselves in sense of looking at how we're doing the thing. And we shouldn't continue to do the things as we are doing it, because obviously it's leading nowhere and making the situation even worse. Thank you.
Thank you. Yes. I'll have a couple of questions together because we are starting to get short of time and I want to hear something.
Maybe we take the round.
Yes, exactly. We'll take a couple.
Thank you. My name is Yossi. I work for UNICEF, and I just wanted to maybe comment on some of the things that have been said so far and ask a question and maybe make a comment or recommendations. Tammam, you were mentioning earlier what can you do, what can we do differently to keep in mind people with disabilities when we plan our response? I think the simple question is we have the tools available. We have questionnaires for surveys, for assessments, where all the different groups that we are able to, to respond to are included. From UNICEF side, we have specifically included lactating and pregnant women. We ask affected populations about how many children there are, the different age groups, and we do also include questions on people with disabilities. So I think it's not a question about what or how we can do it, but whether if we do it and how we can integrate those issues across our response programs so that it is continuously on our mind. And I just want to echo what one of the colleagues from Amnesty was saying here. I think it's really great to have this panel here at the Congress today, because how often do we actually see on stage people with disabilities? How often are we giving their voice and hearing their voices? And I really want to applaud Henry for what you're giving and contributing here today. It's refreshing. It's surely a tremendous journey that you have been through to come from South Sudan and sitting here in Berlin today and speaking to us. And I think we all should recognize that as for what it is, because I think it's one thing to come from a German or a French or whatever context with a disability compared to a country like Syria or Iraq or South Sudan, and manage to come to this conference today and to sit here and speak to us. So thank you very much, and applauding you for what you're contributing. And I think you're just raising so many important issues. And you were talking about earlier how special needs should rather be called specific needs. And in UNICEF, we're working a lot on inclusive education, for example, to make sure that governments include in their planning and in their thinking, now this is outside a humanitarian, but in general in development context, to think about children with special or specific needs and children with disabilities in their educational planning. So I think mainstreaming those issues into the sectoral work that we do with our partners on the ground, whether it's civil society or governments, is tremendously important. And I think we all ought to think about them more. And we just want to give a very quick example of a story where we have used disability as an entry point. In Syria, for example, our cash programs have been benefiting both children in government and opposition-held areas. And in order to actually reach the most vulnerable children and families, we used children with disability as a target group for entering and even be able to access those populations, which we would have otherwise not have had access to. So just to show that actually disability can be a door opener and something to facilitate access where, you know, there is a very, very sensitive...
Thank you.
Yeah, thanks.
Thank you. Other questions? There was someone... Yes, yeah.
Thank you. My name is Ines. I'm Director of Handicap International Germany since 4 weeks, so pretty new. I have one reflection that's on data gathering. I want to raise attention to the fact that when we gather data about disability, it's not only to ask people about people with disability, but to ask people with disability themselves, which also is often overlooked. The second point is a question to Henry. I would like to know from you, how is the situation of disabled people's organizations or association of the impaired, etc., currently in South Sudan? How well are they connected to each other? And are they consulted by humanitarian NGOs, by local humanitarian NGOs, by international NGOs? How is the interaction with your organizations? Thank you.
Thank you. I'll take, there was another question. Yes, I'll come to you in a second.
Hello, Axel Schmidt from ASB. I could also talk a lot, but I try to keep it short.
Thank you.
I just wanted to emphasize that the whole field of inclusive humanitarian action is very new and very far from perfect, but there are some tools, like the SPHERE complementary standard for age and disability inclusion, which you can download on the SPHERE homepage. In general, we are talking about 15% of any given population, so persons with disabilities is not a small number. And I think what you're showing here is really the slogan of DPO's, Disabled People Organization, nothing about us without us. And I think, okay, it works for persons with disabilities, but to me, it also works in general with affected communities. So without consulting them, you will never find out what the needs are and what the right way to find their dignity is. And I also want to emphasize the first step on any humanitarian action is the identification. For example, now in Sulawesi, I'm not sure how many persons with disabilities are actually identified in the crisis, and if the tools are in place to do so. Thank you.
Thank you. I'll take the last comment from the lady here before we go on a round of answers and close the session.
Okay, thank you. I would like to direct my question to Ghida with regards to gender-based violence. You mentioned that you do rehabilitation, which is sometimes called male engagement in addressing gender-based violence. So what I would like to know, what would be your answer to people who say that when you do that, you're actually taking the discussion away from the focus where you are addressing putting forward the issues of women and girls who have been violated. And also I would like to know what has been the success rate, if there is. Do you have any stats on how that is progressing? Thank you very much.
Thank you. I will have to stop here with the questions, and I will ask, please, starting with Ghida, to give your answers and your closing statement as well.
Okay. Thank you so much for that, because honestly, the component related to working with men and boys in the organization, in sense, as organization working with and for women and girls' human rights. This twist is not quite easy because, as you well mentioned, the priority is and always women and girls are at the center of the work, but the approach is inclusive to the root causes that are affecting the women and girls. That's why when we started the Men's Center, yes, we had such commentaries. Are you deviating the attention? You're prioritizing men needs on women needs. You might be also taking resources, financial resources that needs to go to the women agenda and giving, they don't need that, they don't need more power, they don't need much attention. That's why it was always very important to ensure like a gender equal and in the integrity in the promotion of that work. If the women and girls are at the core, if men are part of the problem, they cannot be excluded from the solution, full stop. If we're talking about reducing the percentage of violence, and this is the answer that we provide. So you're saying they're committing that. Are we against men or against violence? We're against violence. What is causing violence? Gender socialization. Is it affecting everybody? The boxing, the gender boxing, how we're putting the characteristic of what does it mean? Does that mean to be a woman or a man in a society? It affects both, but who's paying most the cost as victim? It's the woman. Then, if we want to work around that, we cannot only continue to heal bruises of women as victims. We want to change the scenery. And honestly speaking, it took us 2 years to work on the communication strategy for the Men's Center and to start the actual operation. Today, every year, we have almost between 300 to 350 men coming voluntarily, violent men, and those committing sexual harassment and abuse, coming voluntarily to the Men's Center asking for psychotherapy. And usually, because with each man we work like for 1 or 1.5 years, the ratio of success so far is 36%, not more than that. Sometimes we go to the second step of couple therapy and then family therapy, and sometimes it's only about working on the individual therapy. But in a context like Lebanon, having like men, Lebanese men, or even men from Iraq or Syria that are, or Palestine residing on the Lebanese territory, have them come without a judgment from the court to come to do that, by itself coming is a success, because they're realizing that that there is a place with full confidentiality, zero money to pay, and respecting privacy is giving them the space to reflect about that. And this is how we present it. It's a space for positive anger management and positive stress management to prevent violence.
Thank you.
Thank you.
Ulrike, please.
Thank you. What could be a closing statement? So I'm inviting you to become experts on inclusion. We are sharing willingly our expertise on how to do that. And we do that with different projects in the field. And it's not only us, it's also CBM, ASB, HelpAge, organization like Henry's organization. We are sharing our expertise. Make use of it as long as we are sharing it, since we're also sometimes competing for funds. We want to become mainstream and not a specialized agency, and hopefully in 5 years, we will not receive people with disabilities who just need a shelter, who need education, who need protection. Hopefully by that time, we can send them back, or they don't even arrive. People will not say anymore, go to handicap. Okay, we will send them back.
Thank you, Ulrike. Henry.
Yeah, thank you very much. So I'd like to answer the question that was asked about the situation of the organizations of people with disabilities in South Sudan. And I would like to say thank you very much also for your encouraging words. But I would like to thank the organizers of the conference as well, because they facilitated my trip here. Now, so in South Sudan, the organizations of people with disabilities are, we still have a long way to go in terms of being powerful advocacy organizations, and that's because you find individual organizations, which is okay, but we have yet to establish like an umbrella organization that brings together all types of impairments. But a major challenge facing the disability movement in South Sudan is the issue of funding. But also the organization that I work for example, it's difficult for us to have people who are working full-time because of the issue of paying salary. So most of us have also to do other jobs for you to meet your personal needs. So that also makes it difficult now for us to like have somebody attend cluster meetings regularly and have people engaging with this with international organizations and donors. But also, yeah, issues of logistics. So it's very much a situation where you have organizations trying to establish the link. So for example, yeah, with organizations like Humanity and Inclusion, we find it easy to link up. But if you talk about maybe UNHCR or other organizations, I think we still have some challenges with that, but we hope that things will change. So for example, that's different from Humanitarian Action, but we were able to get a small grant from American Embassy in Juba to provide a computer training for people with visual impairments so they can use the computer with screen readers, so for teachers and students. But yeah, we hope that we'll be able to, we are trying, we are making some efforts to be able to access funding. Now, my concluding statements would be that inclusion is not rocket science. It is something that we can all do. Now, if I give Apple as an example, the iPhone that everybody else uses is also accessible to me. And that's because they knew that people who are blind also needed iPhones and iPads and all their products. And they just incorporated the voice application. So you don't have to pay more for that. So universal design is something that we should promote. So I would say inclusion, yes, nothing about us without us. And together we can all achieve an inclusive society and a world where everybody is happy. Thank you.
Thank you. I will not even try to follow that up. So I will say that it's been a privilege. The privilege of having the colleagues on the panel, but also to be able to sit here on the main platform today and talk about inclusion. There is a trend that this Congress has allowed us to do. Last year, we talked about managing pain and palliative care and not excluding people who have pain from humanitarian medical services. And this year, we're talking about inclusion. The issues, at least in my mind, as a physician, aren't different. We either deal with people we are serving as a whole, or we start picking and choosing. We were told to not treat the disease, to treat the people. And it's the same way that we have to treat the community we're serving, not only some of its parts. So thank you very much for being here today, and until we find another disruptive topic for next year. Thank you very much.